What is Neuralink? Neuralink Corporation is an American neurotechnology company. It was founded in 2016 by Elon Musk, Ben Rappaport, Dongjin Seo, Max Hodak, Paul Marola, Philip Sabes, Tim Gardner, Tim Hansen, and Vanessa Tolosa. The company aimed to make devices that could treat serious brain diseases in the short term, with the eventual goal of human enhancement, sometimes called transhumanism. In 2017, the trademark Neuralink was purchased from its previous owners, and by September 2018, Musk was the majority owner of Neuralink, but did not hold an executive position. The role of CEO was assigned to Jared Birchall, who was previously listed as CFO and president of Neuralink. As an executive of various other companies, Musk was assigned the founder or co-founder position in the company. During an event, Musk explained that he got partly interested in the idea of Neuralink from a science fiction concept called neural lace. He defined the neural lace as a digital layer above the cortex that would not necessarily imply sizable surgical insertion, but would ideally be an implant passed through a vein or artery. Musk explained that the long-term goal is to achieve symbiosis with artificial intelligence, which he perceives as an existential threat to humanity if it goes unchecked. Presently, there is already neuroprosthetics that can interpret brain signals and allow disabled people to control their prosthetic arms and legs. Since its founding, the company has hired several high-profile neuroscientists from various renowned universities. In fact, as of July 2019, it had received $158 million in funding, of which $100 million was from Musk, and had employed over 90 employees considered to have high IQs. At the time, Neuralink announced that it was working on a sewing machine-like device capable of implanting very thin, 4 to 6 millimeters in width, threads into the brain. This procedure was demonstrated on a system that reads information from a lab rat via 1,500 electrodes, and is anticipated to start experiments with humans in 2020. Musk aims to link that technology with implants that, instead of actuating movement, can interface at broadband speed with other types of external software and gadgets. Musk reassured the audience that implanting the device would be as safe as having laser eye surgery, but the company is yet to seek FDA approval, which it will need to market the device. Although authorities say that the main issue isn't just the health risks, society will need to consider what to do with the data recorded by the N1. The N1, a 4mm square chip, is implanted into the skull. Attached to the chip are wires thinner than human hair, which reach out into the brain. These threads are placed close to essential parts of the brain and can detect messages as they are relayed between neurons, recording each impulse and stimulating their own. Neuralink says the N1 can connect with 1,000 different brain cells, and that a patient might have as many as 10 N1 chips implanted. The chips connect wirelessly to a wearable device that hooks over the user's ear, much like a hearing aid, and contains a Bluetooth radio and a battery. Neuralink says the first devices will be implanted via traditional neurosurgery, but eventually the chips will be inserted safely and virtually painlessly through small incisions by a robot surgeon. The technology could help with neurological disorders, which are rooted in the inability of the brain to connect with nerves around the body. These include epilepsy and Parkinson's disease, but also paraplegia and quadriplegia following injuries to spinal nerves. Musk hopes for human studies to begin as early as 2020, a date some say is wildly optimistic. At the launch, Neuralink CEO Max Hodak stated that the first patients will be those with quadriplegia due to spinal cord injuries. These patients will have 4 chips implanted, connecting with up to 4,000 different neurons. It ultimately will be to make up for entire lost sections of the brain due to stroke, accidents, or congenital disease. This is quite exciting, but the real potential of this technology is in its transformational capacity for restoring brain and motor functions. Musk and Neuralink published a white paper detailing their advancements. A pre-peer review version was published in August. A brief quote from the paper says, "The The brain-machine interface holds promise for the restoration of sensory and motor functions and the treatment of neurological disorders, but clinical brain-machine interfaces have not yet been widely adopted, in part because modest channel counts have limited their potential. In this white paper, we describe Neuralink's first steps towards a scalable, high-bandwidth brain-machine interface system. We have built arrays of small and flexible electrode threads, with as many as 3,072 electrodes per array distributed across 96 threads. We have also built a neurosurgical robot capable of inserting 6 threads, 192 electrodes per minute. Each thread can be individually inserted into the brain with micron precision for the avoidance of surface vasculature and targeting specific brain regions. Experts all over the world have unanimously agreed that Neuralink could be the next big thing in the world of future technology. However, a lot of people still hold reservations about it. That's it. Thanks for watching our video, and please hit that like button and subscribe to our channel for more interesting content.